Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
And greetings. Thank you so much for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. And we're so happy to be joining you, and also you can always find us on iHeartRadio. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, I'm so happy to have as my guest Sarah Chana Silverstein. And Sarah is a registered herbalist, and she is a master herbalist and also the mother of 7 children. She runs a pediatric and women's clinic in Brooklyn, where she specializes in children and women's health. She also does TV segments teaching people how they can safely integrate natural medicine along with conventional medicine, which is a big concern. She also guest lectures at medical schools. And on today's show, we're going to discuss Sarah's new book called Moodtopia: Tame Your Moods, De-Stress, and Find Balance Using Healing Herbs and Aromatherapy. And you can find Sarah at sarahchana.com, as well as looking for her book, Moodtopia. Thank you so much for joining us today.
Thank you for having me, Ellen. I always love talking to you about herbs.
It is one of our favorite topics, and there's the American Herbalist Guild Big Conference coming up that I don't know if you'll be there, but I'll be there. And it's just an ongoing level of learning because there's never an end. So, Sarah, let me ask you this. What is the letters next to your name? I know what AHG is about. We'll talk about that too. What is IBCLC?
It's International Board of Lactation Consultants.
Now, what do you do then? Is that someone who would be sort of like with La Leche League, or, in what way is that helpful?
Well, La Leche League is a phenomenal organization. It's a little bit more of a rah-rah team encouraging women to breastfeed. What I started doing 26 years ago was seeing patients who needed problem solving. Maybe they had a tight frenulum, which is a little cord under their tongue. Maybe they had a high palate. Maybe it was a baby that was having before and after open heart surgery. So when you're in IBCLC, I work along with doctors and help these babies that are struggling on the breast learn how to breastfeed. And it's very fascinating because I had become an IBCLC International Board lactation consultant, and I was helping women with breastfeeding problems. And I was trained in Western conventional medicine. And I had studied herbs beforehand, not as professionally as I did after. And one of the things moms really would always ask me, Ellen, was what can I do naturally to help my problem? I mean, women were getting breast infections. They were being referred to take an antibiotic. And I was like, women must have had these swollen problems in the past. How did we treat it naturally? So I started doing research, and one of the reasons I became so popular as an IBCLC was because I started to integrate alternative medicine for these moms, and I really found that with these breast infections, Ellen, that we could treat them without antibiotics about 98% of the time. Women didn't have the side effect of a yeast infection. Women got better. Women felt better using natural methods, and that's really where I took off and really started learning herbs and homeopathy professionally.
So one thing led to another, and you found that really that's what we call integrative medicine,
yes,
where we integrate what's best from all systems and all knowledge.
Right. I mean, I'm not saying that women don't occasionally, especially if they have an abscess, need an antibiotic. But what I found was 9.5 out of 10 times we could fix it with other means, which was just a better way of going with a postpartum mom and a new baby. And it was exciting to see.
And when you say better way, I would say that's true about natural medicine in a very broad sense, where if you're looking for the evidence, if you're looking for the lowest cost, if you're looking for the best outcome in terms of risk-benefit ratio, I really believe that natural medicine should be the first standard of practice that is used for those reasons. Best evidence, best effect, least side effects.
Well, I'm going to tell you because we brought it up. If a woman had a breast infection, simply doctors were saying that you needed to put heat. But the truth is that when you have a swollen breast, you need to reduce the inflammation. So I began using ice. Because when you use ice, it reduces swollen tissue. Then I would make a poultice. I would take a grated potato. I would mix it with some slippery elm bark powder, either put it in an old knee-high or a piece of cheesecloth, and women would wear it up against their breast, and I would teach the babies how to drain the breast properly, and the inflammation would go down. They would stop having fevers. The inflammation would go down. It was actually a very easy way to fix this problem, whereas women were coming to me having been on 3 rounds of antibiotics, and they still had the same swollen tissue, Ellen. So here we were solving it so easily, pennies on the dollar. All women needed to do was to be guided in the correct fashion, and boom, they and the babies were better. So it was so eye-opening to see how much easier it was to problem solve than I was initially trained.
Yes, it's so true, and less expensive and lower risk. That's what I'm saying.
Right.
It should be standard of practice.
Absolutely.
And I actually think it's criminal that it's not. So that's a big push of mine at this time.
Yes.
Now, let's talk about your new book, Moodtopia. And let me reintroduce you at this point. You are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse. And today, my guest is very knowledgeable herbalist, and her name is Sarah Chana Silverstein. She has many different aspects to her practice, which is in Brooklyn. And today we're talking about her new book, Moodtopia. Now, what made you choose this topic to focus a whole book on, Sarah?
So, I've had a women and children's clinic for the past 26 years, and I deal with a variety of ailments that come my way. But one thing that I was really surprised about was when I started reading the statistics about women and men that are using psychotropic meds. The studies show that 1 out of 5 Americans are on psychotropic medications. What the studies are showing is that it's being prescribed by their GP, their general practitioner. And the general practitioner is taking between 6 on the high end, 8 minutes with the patient. And what used to be normal complaints like, I feel sluggish in the middle of the day, or I'm frustrated easily, or I've been crying a lot, or it's hard for me to go to sleep, was instantaneously being prescribed these kinds of very strong psychotropic meds. Now, psychotropic medications can save some people's lives. I'm not against it, and there are some people that need it. But it was not 1 out of 5 people. So when I wanted to introduce the world to my herbal knowledge, and I felt that having a book on our emotions and herbs that can help with sadness, help with frustration, was a book that I didn't see on the market and I felt was desperately needed.
Well, that's a really good focus. Now, Sarah, what you said is so true. Especially you pointed out that most physicians in conventional medicine really have to see patients in a period of time of about 8 minutes. That's prescribed even through their insurance companies that they're working with. And maybe someone might say they feel sad, but you wouldn't know why. Maybe their husband passed away a few weeks ago, or they lost their job, or who knows what's going on in someone's life. And that is not even explored.
Absolutely not. When you work with an herbalist, or in my practice at least, I minimally spend an hour and a half with a person. That's minimal. That's my consult. And I ask 100 million questions, and I really try to see, is something physically going on that's creating this emotion? Is this emotion something that we can problem solve in an easier way? I'm really exploring and getting to know the client, and then we come up with a plan together that's going to work. And I want to be a partner with my clients. And unfortunately, because of the limitations of insurance, like you explained, even if doctors want that, they don't have the luxury of establishing that kind of relationship. You know, I've been doing this for 26 years, and I work with so many families, Ellen. I had a client come to me from Montreal, and I had never worked with her, but she had been referred by her cousin and her cousin. So she walked in, and I said, "Oh, are you here for eczema?" She looked at me. Her eyes were bugging out of her head. She said, "How do you know?" And there was nothing apparent from what she was wearing. I couldn't see. I said, "Oh, I just see that it runs in your family." And she goes, "Oh, I know it does." So if I wasn't so familiar with her family, I would not have been able to pick that out. And that's how doctors were for so long, Ellen. There was the family doctor. The doctor knew the family, knew the community. We don't have that anymore. We have these clinics where people can walk in off the street, and you've never seen that person. You're never going to see them again. And most importantly, Ellen, is that most of these doctors are not seeing follow-up, and that's where I learn. When I see follow-up, I see, is the action of this herb the correct one? Is this herb or homeopathic remedy working? I get to see that follow-up, and that's what conventional medicine is really missing these days.
Yeah, that is interesting, because usually after they see you the first time, let's say you have a skin issue, since you brought up eczema, they'll just say, well, go to your dermatologist.
Yes, and then when you're at a dermatologist and you're with a big practice, very often you don't see the same doctor 2 times. And, you know, the way the one doctor writes down the notes may be a very different way, because we don't have a standard of note writing. So it's very important when you work with someone to make sure that you do follow-ups with the initial practitioner that prescribed that medication or that herb, because that way that practitioner can really get to know how your body is responding, because we all respond differently. I mean, here's the example. One person can have a cup of coffee and they feel this buzz hyper feeling for a couple hours. Another person can have a cup of coffee and they really don't feel any difference, and an hour later they're going to take another cup of coffee. So we all metabolize herbs and medications at a different rate. We all respond differently, and a lot has to do with our size, our weight, and just the way we're structured. And unfortunately, our doctors are not necessarily taking all that into account, and that's where herbs shine. Because when you're working with an herb, you can take a little more one day, a little less one day. You can play with how many drops you take, and you'll be able to work with the practitioner to find what is your correct dosage. And that's what I find is so astonishing, that people will work with me, Ellen, and they'll say, you know, I took 25 drops of motherwort. Motherwort is an herb for hormonal moodiness or grumpiness. And I'll say, you know what, if you didn't feel the effects, let's take 40 drops. And they'll call me back and go, you know what, that little bit made a difference. So we can customize how often they take the herbs and how much they take the herbs, because we have that conversation going on.
Yeah, when you bring up motherwort, that's a beautiful plant to grow in your garden. It's a big giant mint. And in my book, Cycles of Life, I actually talk about the fact that that particular herb, it's interesting that you brought it up, Sarah, is very, very good for, like you said, various feelings of discomfort, but particularly at 3 a.m. It has been studied to be specific for women, especially women, but men too, who wake up around 3 a.m. with thoughts racing in their minds, which we so often see with change of life. And it's really amazing how very specific plants can be, yet how mild they can be.
Yes, that's a wonderful point. I love to hear that. And, you know, I love that you said it's used for women and men. When I was originally training, I learned that motherwort, hence the name, was basically for women. I had this woman's husband in my office once, and he was so grumpy and so gloomy. Everything he was telling me sounded like he needed the plant motherwort. So at that point, I didn't know whether it was used with men as often as with women. I took a plunge. I suggested it. And 2 weeks later, his wife called me back and said, oh, my gosh, he is so much better, Sarah Khanna. What is he taking? So I agree. Even a plant called motherwort works for men and women, and it's just wonderful to see.
Well, I'd like you to know, we're going to take a little break here, that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. Listen live online at nccradio.org or on iHeartRadio. For more information on today's guest or topic, email us at